I work for AT&T. Our operations staff brought in a health fair. The biggest thing I picked up was information on how to understand the signs of a stroke when you see them. And that came into play for us 5 days later.
Went to my office, I was fine. Went into my first meeting, I was fine. But when I got ready to leave the meeting, my leg began to drag. I kept feeling like I was falling. I had my cell phone in my hand, and it threw my hand through my phone across the room. Besides working at least 8 to 10 hours a day as a counseling manager, I also run another business. I also have my own radio show that I do every week. So I went to go do my radio show, and my leg was still dragging, still felt like I was falling, but I wasn't falling. Everyone just chalked it up to, she's tired.
She went to the restroom about 4 in the morning. I heard her nearly fall. I jumped up. She came out. She was like, my leg is still dragging. And that's when it hit me. I'm like, her phone dropped and her leg's dragging. So I had her sit down on the bed. I said, hold your arms out in front of you. And her left arm kept drooping like this. We've got to go to the ER now.
Stroke treatment is very time dependent. Every minute that passes before a patient is seen, brain cells are dying. So the recognition of a stroke is the most important step in starting the chain to getting the patient at the right hospital and the right treatment. If the stroke isn't treated right away, if the clot that's blocking the vessel that's causing the stroke isn't opened, then the arm weakness, the leg weakness, the facial weakness, or the speech difficulty that the patient presents with can become permanent. Because Shawn was able to recognize the symptoms of a stroke quickly in Catrina, he was able to get her to the hospital where rapid treatment was instituted. The earlier the stroke is treated, the better the outcomes.
At health fairs, we talk to people about the signs and symptoms of stroke, how to recognize it, and what to do when they see the symptoms. So essentially, we go over the FAST acronym, face, arms, speech, and time, talk to them about risk factors, and we also talk to them about what services we provide here at Medical City Plano, since we are a comprehensive stroke center.
Knowing that we were able to provide information to Shawn so that he could go home and recognize the signs that he saw in Catrina is amazing, and it's why we do what we do and why we love doing the health fairs.
Thank you from the bottom of my heart. That conversation with me kept my life from being devastated.